Welcome to Playful Beginnings, a podcast about the magic of play therapy for therapists, students, and anyone interested. In our podcast, we'll explore the deeper understanding of play therapy and the skills we use when working with children.
We hope to help you understand the why behind what we do and how it helps kids heal and grow. I'm Dr. Christy Opiola, a working play therapist and university professor in North Carolina.
I'm Dr. Maggie Parker, a play therapist and professor in DC. Hi, you guys. We're so lucky today to have an amazing and spectacular play therapy expert as one of our guests. We have Dr. Regine Chung. She is an assistant professor at University of Houston. I'm sorry, Texas State. My apologies. I made that mistake before. Texas State. She is also a founding member of the board for Child-Centered Play Therapy International and a trustee of counselor education for the Association for Child and Adolescent Counseling, has published numerous studies on child-centered play therapy. And I think one of the most exciting studies that we've seen so far, and really what we hope to talk about today, is a longitudinal study of child-centered play therapy with children who were diagnosed with ASD or ASD.
Autism spectrum disorder.
Thank you. Whew. All right. So welcome. Yay. And also a fellow graduate of UNT. So one of our, our circle,
Yeah, close colleagues.
Close colleagues. Yeah. So welcome.
Hello, everyone. I'm very excited to be here. Oh, thank you, Christy. Do you think it'd be helpful that I'll go ahead and explain the study that I conducted as well as some of the results before we moved on to questions like how the changes came about?
Yeah,
sure.
Yeah, okay. So for my study, it was actually conducted, towards the end of, the COVID pandemic where schools started to reopen. And so there were some difficulties and challenges with recruitment and leading to having to do recruitment and conduct a study for over 2 years. So during those 2 years, what I did was that I recruited autistic children, those who have either been diagnosed by a pediatrician or a psychiatrist or a mental health clinicians, or they have received assessment in the schools to receive autistic services. So altogether, initially, I recruited over 20 students who were placed in schools and placed in an education setting with accommodations for autism services. And then eventually 19 students completed the studies. And these students are on average about 5 years old, and they were children who have various level of speech and language abilities. Many of them were non-speaking or minimally verbal. And then we have like one portion of the kiddos also were having cognitive or intellectual disabilities. So just based on the demographics, you can hear how they are considered probably, if you use the DSM diagnostic manual, you will see that they are considered those who have more substantial support needs. And then with this group of children, what I did was that me and two other play therapists conducted child-centered play therapy with the students. And we did data collection before play therapy, after 8 sessions, after 12 sessions, and then after 16 sessions. And what I was interested in learning about is how these children change based on their social emotional competence, such as their empathy levels and their level of social withdrawal or engagement, which is like their social competence. And then I also use another instrument, which is the aberrant behavior checklist that measures typical emotional and behavioral challenges experienced by autistic children. These are hyperactivity, irritability, social withdrawal, and the speech, problematic speech, as well as the last one is what's the last one? I need to go back to look into this, which is their social. I mentioned social withdrawal already, right?
Yeah.
Irritability, hyperactivity.
I think the hyperactivity was one you didn't mention.
Hyperactivity and non-compliance
Okay.
is the one. Yes, that's right. Need to go back and look at my cheat sheet right here. Oh, stereotypic behavior. Because that is the one that didn't show significant changes, but I do have a theory behind why that wasn't decreased within my group. So altogether, these students, what we noticed was, and what was like the most important findings from the study is that when I measure the changes in all these like different areas, right? Well, first of all, after 16 sessions of CCPT, you see an overall improvement in the all of the aspects, meaning in terms of the strengths, social and emotional assets. We see an increase in those areas. And in terms of the behavioral and emotional challenges, we see a decrease overall along the several areas. And then another important finding is that when we look at when changes happen, so before play therapy, everyone was showing some clinical concerns, meaning if they were being placed in a clinical setting, they will be suggested intervention. Now, after 8 sessions, what we have found is that the most recognizable changes that teachers saw in the classroom is their improvement in the level of empathy, which
Interesting.
In just
which
8 sessions?
yeah,
Yeah.
after 8 sessions and that parent teachers noticed that the increase of empathy and the questions that we asked in the survey in the instrument is whether the child is able to recognize people's feelings even without you telling them. So those are like and that they were able to recognize others' emotions, or based on the teacher's report, several students actually did something to comfort a friend, like let's say standing next to someone who's upset or trying to tell the teacher when they notice someone was upset. So those are indicators of the improvement in empathy, and then also an increase. And then after 12 sessions, the empathy level continued to increase, and then a more bigger changes that the teachers noted is there that the children decrease in their social withdrawal. So you can imagine these children before the study, several of them who show high scores of social withdrawal are those who usually wander around when everybody is doing their circle time, or let's say when there's like some kind of like group activities, maybe it's more like highly energy activities that these children will need one-on-one with a teaching aid, or sitting in like a quiet or like a regulation, like a relaxed corner. So they always need the solo individual activity when some group activities were going on. And then after 12 sessions, the teacher noticed that there are the decrease in their social withdrawal, that instead of needing one-on-one or having to separate themselves from the group, they actually see an improvement in these children willing to sit in a circle, even though they may not be ready to engage or participate, but they feel less hesitant or less reserved about like whether or not I want to be in the group. And then
Really quick. Oh, sorry. Chrissy, did you have?
Good question too. No, go ahead.
No, you go first.
but before that, I feel like maybe I should wrap up with the results of the study regarding like what teacher sees like after 16
Yeah,
sessions. And then
sure.
we can go into the explaining, okay, what I believe happened
Yeah.
within those children, right? So we talked about that lessening or the reduction in social withdrawal after 12 sessions, and what teachers saw after 16 sessions is the decrease in their irritability and their hyperactivity and noncompliance. So, what it meant was that the teachers noticed that the children were less emotionally reactive, less power struggle in the classroom, and less emotional outburst. And when you think about it, through a CCPT conceptualization, is that when we see these acting out behaviors, when we see the emotional outbursts, those are the results of the child's distorted or a negative self-concept, right? So when we're able to help them build empathy, when we're able to help them build a lessen their anxiety when participating in this social setting. We see that they have less need to have these externalized behaviors in the classroom. And I thought that was fascinating and definitely something that I continue to see in the playroom. Like, I mean, I first saw the changes in the playroom that these children has higher tolerance for frustration. Many of them worked on that transition from the playroom to the going back to the classroom, which is, that change of activity, change of routine can be a struggle for many of them, and that they were able to respond to the therapeutic limit setting positively. And therefore, in the classroom setting, you see there that they have less externalized behavior. So I thought that was very interesting and important to
Yeah.
share.
Yeah.
Yeah. And then another aspect that just now when I was sharing about the measurement that we were using, there were two other subscale that we measured, which is one is the stereotypic behaviors, and then the other one is inappropriate speech. For inappropriate speech, we see a decrease over the 16 sessions or the 4 data collection point, but then the changes were not statistically significant. But what we understanding from this result is that because it measures like overt repetitive speech patterns that according to the measurement is atypical or problematic, but many of the students who took part in the study were minimally verbal or nonverbal. So therefore, we just do not have the enough data set to see if this is something that can be addressed in CCPT. So I want to point that out. And then another aspect that we did not see a statistically significant change is the stereotypic behaviors. Again, when we look at the data, we see a decrease overall. However, the neurodiversity affirming perspective to look at it is to also recognize that stereotypic behaviors such as stimming, or sometimes it can be like body rocking, or sometimes students engage in some kind of like motor expressions, right? Those can be seen as self-regulatory behaviors. So this may not be a primary goal for a CCPT therapist to address in our intervention, which is to minimize or to distinguish, or not distinguish, extinguish these type of behaviors. So those are the areas that seems to be not of a primary concern for us as
Great.
adjustment play therapist.
That's really interesting.
Oh, thank you.
Yeah. Yeah. Well, this was so helpful. I really appreciate you coming on. I think just like for our listeners to see kind of like what has been done, parents, I think is really beneficial.
Well, I'm glad. I'm glad that you find it helpful. I feel like I'm like just going on and talking about like all kinds of things, maybe not in the most organized way.
That's pretty par for the course for this podcast. We get on a topic and then we get excited about it and we have rabbit chases.
Rabbit trails.
There we go. So yeah. Well, thank you so much. We're so lucky to have you. And so everybody, yeah, listen and read her studies and we'll post those to our website, or not to our website, but in the newsletter. So if you want to get our newsletter, go ahead and like and subscribe and through our website. You can email us at info@playtherapyspace.com or Christy at playtherapyspace.com, Maggie at playtherapyspace.com. If you have any questions for Dr. Chung, you can reach out to us and we can facilitate that. And yeah, this was lovely.
Dr. Chung will be speaking this summer at UNC Charlotte's Multicultural Play Therapy Conference. So if you want a more in-depth exploration into play therapy with children on the autism spectrum disorder, come check us out.
So, well, thank you so much.
Thank you for having me.
Bye.